I'm Mark Caney from PADI. This following video is of interest to anyone who is working in the UK because it concerns HSE diving medicals. This is not really very relevant to anyone in the rest of the world. Okay, it's Mark Caney again here, and today I'm talking to Dr. Andrew Kaye, who I know because he has recently done my HSE medical, and I'm glad to say I passed. And that was a medical based on the new guidelines which have come out at the end of 2015, and those guidelines have changed, and we're going to be talking about some of those changes and what the influence is on British divers. Mm-hmm. Let's talk first of all about BMI and how that's measured. And I know there are a couple of trigger points in the number of BMI, and then it comes down to what kind of a body shape you have, whether you may be athletic but big or simply big.
Yeah, I mean, basically, anybody with a BMI of less than 30 is going to be okay, irrespective of their shape. If your BMI is over 30, but between 30 and 35, then you still may be able to pass the HSE medical, provided that you're a more muscular build and that your waist circumference isn't too great. So this is where we're trying to discriminate between people who are overweight because they're heavy, strong, stocky build, perhaps a bit like a rugby player, say, or somebody who's overweight because they're a bit overweight, a bit tubby, let's say.
And I know if anybody wants to, they can quite easily work out their BMI.
Yes, yeah. I mean, the BMI is dead easy. Well, I say dead easy to work out. I think it's based on a calculation on body height in meters divided by the square root. So it's.
I think that the simplest way is you can look on the internet.
There's a little app you can get, or just go on Google and there's a body mass index calculator.
Yeah.
It's very easy to find. Just type in your body height in centimetres and your weight in kilograms, but there is a non-metric version as well, and it gives the same results.
Okay. So if someone was concerned their BMI is above that 30 level, and they want to get some guidance as to whether or not they may have an issue, what could they do?
The best thing really is to try and have a word with the AMED before your appointment with the doctor to avoid wasting any time. Most AMEDs will be willing to give you a bit of quick advice if your BMI is over 30. There is also there are some useful guidelines on the HSE diving website on the MA1 form under the section of body mass index or obesity, and that gives you some very clear guidelines in the form of an algorithm about what you can do if your BMI is over 30.
And we're actually going to put a link to those guidelines at the end of this video, so if anybody wants to, they can look up and try and do the calculation themselves.
Yes, it's got all the information you need about fitness to dive, BMI, general fitness, and any other condition that you might want to check about before your medical.
Okay. Now, another key part of the guidelines which have changed, and to my mind they seem to have become more rigorous, is how we're measuring fitness, which is a VO2 measurement, I believe.
Yeah.
Can you talk about that?
Yeah, the fitness test is a big part of the HSE medical. They, in the new guidelines, as from October 2015, they have raised the bar a little bit. They've gone from a VO2 max of 40, and it's now gone up to the required standard is 45 mils of oxygen per kilogram per minute. So anybody who was slightly on the borderline before will now probably find themselves technically unfit for the dive medical. So you need to, anybody who was slightly borderline before will now need to try and improve their fitness to.
How are you actually measuring this when the test happens?
Well, anybody who comes to see me will probably, and most of the dive doctors for that matter, will probably use the Chester step test, which is very simple piece of equipment costing about £10 if we can get.
I think you brought the step we have.
Yes, yeah. This is the this is a step.
Pass it up so we can see that.
Yeah.
So it's not terribly high.
That's exactly 25 centimeters. Is that particular one?
But you're stepping up and down,
yeah,
and it gets
yeah.
faster and faster.
It needs to be the correct height. To do this test correctly, you need to have the step that's exactly the right height, and you need to have exactly the right rhythm, and follow the protocol to do the test. It's very straightforward. It's fairly foolproof, and you don't really need any complicated equipment. You do need the music to go with it, or the click test.
Yeah, it's lovely music.
Yeah, everybody loves it. It's ingrained in my poor brain. And that's, you can either get that as a Chester Step app for your smartphone, or there's a Chester Step Test music CD that you can also get, and I can show you how to get that at the end of the.
Right, and the reason the music's relevant is because it has a kind of a metronome noise which gradually increases in pace, doesn't it?
Yes, the Chester Step Test goes on for about 10 minutes, and there are 5 sections to it. Each section is 2 minutes long, so it starts off fairly slow, about 60 beats per minute, 60 steps per minute. Then it goes up to 90, then it gradually increases up to 120 and beyond. With a slight interval every 2 minutes, just to check the pulse rate and just to see where you're at, so that you can record the pulse rate at each level. And then you put all these, you get 5 pulse rate measurements at the end of 2 minutes, 4 minutes, 6 minutes, 8 minutes and 10 minutes, and you plot these on a little chart, and the gradient of the chart gives you a fitness measurement as a VO2 max.
I think this is something that a lot of divers probably want to prepare for, and they can actually measure it themselves and see if they're getting to that key 40 level.
Yeah, I mean, anybody who's a runner or is very fit and is nice and slim probably doesn't have too much to worry about, but sometimes if they're unfit they do, and it is a test that you can train to do with a month or two before your HSE medical, if you are a little bit worried.
And it makes sense for people to do that because there is an expensive course.
Yeah.
So
if you fail your HSE medical, it's a nuisance, because the doctor may ban you from diving temporarily until you get fit. So yes, there's a big inconvenience, especially if you're diving for a living. It's really important to make sure that you're fit before your medical, and it's easy to do. Even I can achieve the required levels of fitness, but you do need to do a little bit of training, especially if you think you're borderline.
So if a diver comes for their medical, and for some reason the diver doesn't appear to get up to one of the standards required, what options are there to the doctor? What can happen then?
If somebody's not quite fit enough and fall below the 45 VO2 max cutoff, then it depends really. Usually, in my experience, I end up giving a restricted medical, and usually I put a time limit on the medical. For example, I might give them a certificate that only lasts for 3 months instead of 12 months, and in that 3 months I'm allowing the diver to continue to dive and work for a living, because I don't want to cut off their livelihood. But on the other hand, I want them to go out there and get fitter than they are at the moment, to come back, and I'll retest them, and hopefully by that stage, with a fairly major threat looming over them, that they will have improved their fitness to the required level.
Could that apply as well if they failed under the BMI criteria?
Yes, yeah, these are BMI and fitness are both easily modifiable risk factors, if you like. They're both things that you have control over. We can all, if we put our minds to it, either get a little bit fitter or lose a little bit of weight. Obviously, you can't do much about other certain medical conditions, but fitness and weight are two things that you can do something about.
And actually, we as PADI have been in discussions with the HSE about the medical criteria, and they did subsequently put out a notification to AMEDs clarifying the fact that we are talking about recreational diving instructors. And these medicals are the same medicals that are applied, for example, to saturation divers, and there is a different working environment.
Yeah.
So I believe it's now the case that AMED can say this is a medical for recreational diving projects.
Yeah, we can stipulate the kind of diving that the diver can do. So if there is a question of a fitness, you can say, well, the diver's fit to do pool diving or do training sessions in the pool, so they can carry on working as a PADI instructor, but have much less challenging environment, say in the pool. Obviously, if you're a sat diver in the North Sea and you're in saturation for a month at a time, you do need to be entering into that environment in a good state of fitness. So we have different, we can apply different criteria and stipulate the kind of diving on the medical, and that will allow us a little bit of leeway sometimes with fitness.
Okay, thank you. And am I right in saying as well that if someone absolutely fails the medical, they have the right to appeal to the HSE?
Yes, yeah, there's an appeals procedure. So if the AMED has stopped you from diving and you're upset about that, and obviously, like most systems, there's an appeal system, a tribunal where you can get a second opinion, and that's a system that's always existed for the HSE.
And finally, on the changes with the medical, are there any other general medical conditions that the guidelines have altered for?
Yeah, the other thing of note is divers with asthma. Now, there are quite a few divers out there, recreational and PADI instructors and HSE divers, that do have very mild asthma that's very well controlled. The HSE have tightened up the rules a little bit, and anybody using steroid inhalers or beyond steroid inhalers are now required to get a full assessment from a respiratory physician, so i.e. a respiratory specialist with an interest in diving medicine. But if you're worried about this, the best thing to do is just phone your AMED up, your local AMED up, before you come for your medical if you've got asthma and you're worried about it, and then we'll be able to point you in the right direction.
Well, Andy, thank you very much for taking the time to talk to us and explain these points. I think the key message here for professionals that are going to take their medical soon is that certain areas are a little more rigorous than they were before, but that you can actually prepare for this yourself. There are tools you can use to check your own fitness and prepare for it. Don't go in without taking those steps to make sure you've got the best possible chance of passing.
I think the conclusion is that don't panic. You know, there's the guidelines have tightened up a little bit, but they're all still easily achievable with a bit of preparation. And at the end of the day, it's there for safety and to just raise the bar a little bit for the whole diving community.
Well, thank you very much.
That's okay. Pleasure.